Hello and welcome to IndiGlobal Media Network Edge Factor. IndiGlobal Media Network Edge Factor brings scientific research based information. Today we are going to talk about COVID-19's rare side effect. COVID-19 has affected more than 4 crore people in India, and the side effects are found in 8% of the population. As the situation evolves in the next 2 years, we are seeing that there are rare cases which are coming up in hospitals. One such rare case has been noted in Manipal Hospitals in Bangalore, where there is regrowth of bones in the muscles. Regrowth of bones happens when you have a spinal cord injury, a brain trauma, or acute injuries. Today, we are going to talk about this rare occurrence with Dr. Gopal Krishna, consultant orthopedic and joint replacement surgeon at Manipal Hospitals, Bangalore. Welcome, Dr. Gopal Krishna.
Thank you.
Thank you. Sir, we have noted a very rare case of bones regrowing in the muscles in a select number of COVID patients. So, why is this happening? And which category of patients are we seeing this phenomenon occurring?
This is seen most commonly in those patients who had a full-blown COVID infection with the severity of infection very high and who required mechanical ventilation. And this also compounded by the fact that when they are on mechanical ventilation, they are immobile completely. In the particular case which we are discussing today, the patient was immobile continuously for a period of 2 months. And unfortunately, this happened during the second wave peak. And it was very difficult to give a individual attention to each patient and do physiotherapy. Saving life was a more priority. So obviously this patient who was on ventilator for 2 months was completely immobile. So COVID infection causes a lack of oxygen supply because of the lung infection. That can affect the circulatory pattern to the neural structure and the muscle, which is a trigger point for the excess bone formation within the muscle. This is definitely compounded by the fact that patients are completely immobile for a longer period.
So, given this situation, there were a lot of patients who were on mechanical ventilation and who were immobile for a longer period of time. So, suppose if they did physiotherapy once they were out from the hospital, then does this chance reduce in them?
It is very difficult to predict which patient will develop this kind of complication. The glitch is there only. It's very difficult to say who will develop this complication. And by doing physiotherapy alone, this couldn't have been prevented because it is multifactorial.
Okay, okay. So, sir, what would it be? Would it be that the person's immunity was low, or they had some genetic composition which led to this kind of regrowth in the muscles?
Definitely, the body nature is a deciding factor, but the immunity is nothing to do with this. This is basically a altered circulatory pattern within the muscle that initiate an event for the formation of the bone. So immunity doesn't play much role here.
Okay. So, how many such cases have been identified so far in India?
On the literature, only 5 or 6 cases are reported till date, and probably this is the 6th case, whatever we
Okay.
are
And
discussing.
yes, and the world over, sir, world over, how many such cases would be there?
Maybe 20 to 25 cases.
Okay. So, can we say we are at the tip of the iceberg and there could be many more, but they have not come to hospitals for treatment?
Very true with Indian population because a lack of awareness and the financial constraints play a very big role in Indian population. Most of them don't seek the medical attention in the right time, either because the symptoms are trivial, they tend to ignore it, or though they have disability, but they cannot reach to medical facility because of the financial constraint. So many people must have been suffering from it, but they have not come to our attention.
Okay, so disability after COVID-19 has to be looked in a different way. And people need to understand that suppose if they are immobile for a longer period of time, or they are not able to walk properly or move their hands properly, then they must approach the doctor, right?
Any patient who has any restricted mobility, altered level of activities in the daily living because of some limitation, pain or stiffness in the joint should consult a bone specialist immediately. as you mentioned earlier, there are several new complications which were never seen or known to medical fraternity are coming up as a complication of COVID. So
Okay.
we are still
So
in the evolving phase.
yes, sir. Yes, sir. I get it. So what would be the symptoms? Like if we talk in terms of a layman's language, what would be the symptoms that they must look out for?
Mainly, there may be pain in the joint, there may be swelling in the joint, a limitation of the movements. They won't be they'll be having difficulty to climb stair. They'll have difficulty to sit on the floor or squat, or they'll be not be able to walk with the face which they were able to do before. Any of these symptoms should alarm them to seek medical attention.
Okay, okay. But would it also then overlap with these other symptoms of arthritis, osteoporosis, and those which we usually see? So would it also require that the doctors would have to first check out whether these are the cases, or is it this issue of the regrowth in the bones?
As the way the new complications are arising, we need a very high index of suspicion. We cannot ignore any patient with any simple joint pain to be considered as a trivial one. That has to be thoroughly evaluated to know that then only we'll be able to pick up these kind of complications.
Okay. And what is the awareness among the doctors? Is there a proper medical, class being given to them that they should also understand that when these symptoms come, they must also evaluate them on these basis. Is there an awareness being created
Very
amongst them?
true. The offline continual medical education, which was going in the pre-COVID era, is now become an online medical education system.
Yes.
So there are continuous online CMEs which are happening, and the medical fraternity is aware of this kind of cases. That is how we've been able to know that only 5 cases are reported so far regarding this heterotrophic ossification, that is bone formation within the muscle.
Yes, sir. And sir, do they once they undergo the surgeries, do they recover completely, or is there a chance that they may have this reoccurrence again?
Whether it is a COVID patient or a non-COVID patient, the chances of a recurrence of that is again a reformation of the new bone is as high as 20%, irrespective of whether the patient is COVID infected or not. So that is where the problem is. And in this particular case, just to prevent medications for a longer time, and immediately after surgery, we have conducted a radiotherapy session for the patient to focus to those joints which were affected. In this case, the patient had both hip involvement and right joint involvement. So radiotherapy was given to these areas after the surgery so that it will kill those cells which were forming the bone within the muscle.
Okay, okay. Now, sir, as we have already discussed, there is a lot of financial constraint in a lot of patients. Maybe the poor patients, but even the middle class is also feeling the heat because of COVID-19 and post-COVID-19 complications. Given this kind of situation, is it possible that this surgeries could be, if the number increases, or there are people who come with really the problem and they require attention, some benefits can be given to them? Is there some kind of talk or think tank being done about that?
The very crucial point here is that identification of this clinical entity in the early stage. Whatever the 5 or 6 cases which are published pan India, none of them required surgery. This was the only patient who required actually surgery because the severity of the infection or the severity of the bone formation was so much that joint were completely fused. This patient was either able to lie down or get up. He was not able to sit. As a result, since he was not able to even sit or bend his hip, he was not able to wear his clothes properly. So it was so disabling. That's why we decided to do the surgery. And this fellow was a breadwinner of his the family, a very young fellow, 32 years age, obviously having high level of demand in his day-to-day life. He would definitely require surgical intervention.
Okay, so have we also seen this kind of trauma in the older population? And this person was middle aged, but the rest 5 cases, what was the age group of the patient, sir?
All of them were between 30 to 45 or 50.
Okay, that is a productive age group.
Productive age group, exactly. Yeah.
Okay, okay. So we haven't seen a case like this in the senior citizens, or
No, no.
Okay, And do they have also comorbid conditions like diabetes and hypertension?
Those things might not directly influence the outcome of heterotropic calcification.
Okay.
Most of them were healthy, active individuals in their pre-COVID life.
Okay. Okay. All right. So where now from here onwards, apart from the awareness that is being created, how is it that one can identify the cases in 2 tier and 3 tier cities? Because these are the places where the knowledge dissemination is very less, and there are also quacks whom they go and visit. So, and these areas also have seen severe COVID impact. So, would it be important that the government or the surgeons from the surgeons get involved in this so that this dissemination can be done to these cities?
Fortunately, the identification of the new bone formation is very easy and very cost effective. A simple X-ray can reveal that there is an abnormal bone which is in the abnormal location. So a simple plain X-ray will bring our attention to this. So whoever, like as you mentioned, the general practitioners at the base level, ground level physician who is attending the patient, if they are aware of this entity, they'll obviously pass on these cases to the specialist, and I don't think so we'll miss out on the cases.
Okay, okay. Interesting. So this is a really important aspect, and as and when we get more of these cases, we shall also discuss more with you. All right. Thank you. Thank you, doctor. Thank
Okay,
you very
thank you
much.
very much. Yeah.
Yeah, thanks.